Hey, hi, I'm Emily. I'm going to be your nurse today. I'm going to check the doctor's orders. He ordered a full head to toe. I'm going to provide privacy, sanitize my hands. Can you identify your name and date of birth for me?
Hannah Hartman, 10/14/2030.
Great. So do you have any allergies? Do
No.
you know why you're here today?
Asthma.
Okay, great. How did you get here today?
I drove.
Okay, good. Do you drink or smoke?
No.
Okay. So why are you here today?
Asthma.
Good. So your thought process is logical, and I rate your Glasgow Coma scale of 15 plus. Okay, so also, can you remember these 3 words for later? Dog, fish, cat.
Dog, fish, cat.
Okay. So now I'm just gonna move on. So I'm gonna be doing some touching. Is that okay with you?
Yeah.
Have you had any headaches lately?
No.
Any pain on your head?
No.
Okay, good. Just by looking at you right now, you are dressed appropriate for the weather. Your skin is appropriate for your ethnicity. I don't see any masses or lesions on your skin. Your eyebrows and your eyelashes are evenly distributed. And your ears are lined up with your eyes. And also, I can see that your hair is well groomed, and you are well groomed as self, and your hygiene is good. And your hair is evenly distributed as well. So now I'm just going to do some palpitations of your skull. Skull is round. Don't feel any masses or bulges. Okay. So that's normal. It's non-cephalic. So now I'm just going to move on to your sinuses. Have you had any sinus infections?
No.
Starting off with your frontal, your maxillary. Okay. Did you have any pain while touching there?
No.
Okay. So now I'm just going to move on to your eyes for accommodation and pupil dilation. So your eyes are white with sclera, and I don't see any abnormalities with your eyelids, and your pupils are even, which is good. So I'm just going to shine the light in and out. Your pupils dilate, and they are at 3. So now I'm just going to move on and do your accommodation. Can you follow my pen with your eye? Okay, your eyes accommodate. Can you look behind me? Okay, pupils dilate. So I'm just doing some cardinal gazes. Can you just follow my pen again? Okay, good. You've accommodated well. So have you had any ear pain?
No.
Any vision loss?
No.
Have you any eye drainage?
No.
Any ear drainage?
No.
Okay. Good. So I'm just going to look in your ears. Don't see any drainage. No drainage. Okay, and they're pink and moist. So now I'm just going to do your lymph nodes, your preauricular, your postauricular, your occipital, your tonsillar, your submental, your supraclavicular, deep clavicular, submandibular, and then your superficial clavicular. And then I'm just going to feel your thyroid. I don't feel any abnormalities of that. Have you had any trouble swallowing?
No.
Okay, so now I'm just going to look inside your mouth. Just by looking at your mouth right now, I don't see any lesions or abrasions, which is good. You just open up your mouth, say ah. So your soft palate, your hard palate are good in good condition. I don't see any cavities. Your tongue raised when you said ah, and your uvula raised, which is good. Your mucosa is pink and moist. Okay, can you say light, tight, dynamite?
Light, tight,
Okay, good. So did you remember those 3 words from earlier?
dog, fish, cat.
Okay, good. That's good. So now I'm just going to move on to look inside your nose. Have you had any nosebleeds?
No.
Any drainage of the nose?
No.
Okay, good. Your mucosa is pink and moist as well. So can you just press against my hand with your head? Press against. Good. Also, I'm going to do some push and pull on your pinna and your tragus. Okay, any pain there?
No.
Okay, good. So I'm just going to turn your head and just going to look for any jugular vein extension. Don't see any there. Don't see any there, which is good. So now if you can just hold your breath while I touch your carotid arteries. Okay, here we go. Okay, I didn't feel any abnormalities with that, which is good. Now I'm just going to take a listen for them to see if they have any worries. Hold your breath. motion on your upper extremities. You had good range of motion on your head as well. So you had good strength as well too. So now I'm just going to feel for your muscles. Okay, your muscles are intact on your upper extremities. So now if you just let me see your hand to check for skin tinting, for dehydration. Didn't feel any skin hydration, dirt tinting. So now I'm just going to check your capillary refill. They retracted within 3 seconds, which is great. So now I'm just going to move on. Just going to look at your chest real quick. I would also do a breast exam as well. Start off with your aortic valve, your pulmonic valve, your Erb's point, tricuspid, and your mitral. I'm supposed for any murmurs or bruits, your aortic, your pulmonic, Erb's point, tricuspid, and mitral. Okay, I didn't hear any abnormalities with that, which is good. Now I'm going to palpate. I'm going to first look for any heaves or lifts. I don't feel any heaves or lifts. Okay, just let me know if there's any tenderness or pain while palpating your chest wall. Is there any pain or tenderness? Okay, I'm just going to do some percussion. Okay, percussion is good. And also check your brachial pulse. 2+. And 2+ for the radial on your right side. 2+ for brachial, 2+ for radial on your left. Okay, now I'm just going to look to see if you have strength on your legs. You just press down. Good. Press down. Good. You have good strength. I'm just going to feel your muscles. Okay, muscles are intact. Skin is warm. So I'm going to check your popliteal pulse. 2+ on your right. 2+ on your left. I'm going to check your posterior tabicular pulse. 2+ on your right. 2+ on your left. Now I'm going to check your duralis pedis pulse. 2+ on your left. 2+ on your right. So I would also do the capillary refill and your Babinski reflex. So I don't feel or see any edema going on, which is good. Okay, now I'm just going to move on. So you just stand up. Can you touch your toes? You can turn this way and touch your toes. There, I don't see any curvature of the spine. You were able to do a range of motion. So I'm just going to feel on your vertebral column. And just seeing I don't see any tactile fremitus. Now I'm just going to feel for on your spine to see if there's any abnormalities with that. I don't feel any abnormalities. Now I'm just going to check for any crepitus by palpating your back. Okay, good. I didn't feel anything. If you just give yourself a hug. Give yourself a hug in the front. I'm going to do some percussion. Have you had any back pain?
No.
Any trouble breathing?
No.
Okay, good. You can let go. Okay, now if you can just take a deep breath. Okay, good. Do another one. Okay, your AP diameter was good. Can you say 99 for me?
99.
Okay, good. I didn't feel any vibration. Now I'm just going to take a listen. You can just take a deep breath when I put my stethoscope on your back. Okay, other side. look for your Pisces. Okay, I didn't hear anything of that. Now I'm just gonna check for any bruise on the back. Just take a deep breath. Your Pisces. Okay, good. I'm just gonna have you face towards me. Okay, close your eyes and try to keep your balance. Okay, good. You kept your balance well. So now if you can just take 5 steps for me. Okay, come this way. Okay, if you can walk on your heels. And then on the way back, walk on your tippy toes. Okay, now walk one foot in front of the other. Okay, and you come back. So now I'm just have you slide your heel down to your foot. Good. Slide your foot down. Good. Your gait was well and your balance was well, which is great. You can sit back down for me. Okay, so now I'm just going to do a sharp versus dull test. So we know if you feel the sharp side or the dull side.
Sure. Go. Sure. Go.
Good sense around your lower extremities. Can you feel this?
Yeah.
Okay, that. You have good facial sensation. Now can you smell this? You smell that?
Yeah.
Okay, good. So I would also do a Snellen eye chart, and your olfactory nerve was intact, and you have great facial sensation, which is good too. So now I'm just gonna have you lay down. Either way is fine. So I'm gonna look at your stomach real quick. So just by looking at your stomach, it's flat, non-distended. As of right now, I cannot see any bulges or masses sticking out, which is good. You don't look uncomfortable. It doesn't look like you're in any type of pain. Are you in pain right now as well?
No.
When was your last bowel movement?
Yesterday.
Any pain on your stomach?
No.
Okay, good. So now I'm just gonna just auscultating first, just to listen to your bowels. Starting your right lower, right upper, left upper, left lower. Okay, great. Your bowel signs are active in all 4 quadrants. Now I'm just going to listen to your bruits, see if you have any, your aorta, your renal, your iliac, I don't hear any bruise, and as of right now, I would have done the femoral pulse, and I also would have did a genital and rectal assessment. You can just sit back up for me, face this way, just kind of sit up. Now I'm just going to check for your kidneys, so pressure on the kidneys. Okay, good. I don't feel any abnormalities with that, which is good as well. And I also would have done a breast exam earlier, if I didn't state that already. Okay, and then now I'm just going to just talk to you about your asthma. Do you have any questions about it?
No.
Okay, good. So with your asthma, just make sure you're always having your inhaler by your side. Do you have an inhaler at home, or do you need us to provide you with one?
I have one.
Okay, good. So with your inhaler, make sure it's with you again at all times. Stay away from any perfumey fragrances. You want to avoid an asthma attack as much as you can. So just also stay away from smoke. I know you mentioned you didn't smoke, but just by secondhand smoke as well. You want that getting into your lungs. It might cause an asthma attack as well. Do you have any other questions for me?
No.
If you have any, just let me know. I'll be here. Okay, have a good day.
Thank you, you too.
Thank you.